Hi, this is going to be my first video in a new series, and this one's going to be a little bit different than what I've done previously. Previously, I had a playlist or a series that was focused on a particular class. It was all the videos that I needed to show for a particular class, an online class. This is going to be a series about pregnancy and related topics, and I'm doing this because I find that when I teach pretty much anything where I have the opportunity where pregnancy comes up, or anything related to reproduction, sexuality, anything, I look at, if I'm teaching in person, students are like this. They're like, I have questions. And we spend a lot of time in class answering those questions. And I don't mind doing that because it's important to answer those questions when people have them. So I generally find that people are not getting a lot of information about pregnancy and related topics and issues. And so I'm going to create videos to answer some of the questions that have come up in class, and then I'll have them ready so that I can use them when things come up. If we don't have enough time in class to address all of them, like, I've got a great video on this, maybe you can check that out. And so other people can use them too if they also are curious about these same things that my students are curious about. If my students are curious, I bet other people are too. So right away, where am I going to begin here? Pregnancy. Let's start with pregnancy. All right. I could talk about how pregnancy happens, and I will talk about that at some point. But one sort of popular topic that I discovered lately is we had this huge class discussion. I ended up making a TikTok video about it too. Of course, with TikTok, you got to make the shorter videos, and with YouTube, I can go a little bit longer. You have the option of continuing or not. The topic was, well, how do you date a pregnancy? How do you calculate a due date, or how long does a pregnancy last? So let's talk about that. When does a pregnancy begin? And sometimes students will seem surprised at the very question, like, well, it begins at conception. That often seems like an intuitive answer to most of my students, at least, based on their reactions, what they tell me. All right. Depending on who you are talking to or what resource you are looking at, that might be a correct answer. So if you are looking at a developmental science textbook, a human development textbook, biology textbook, embryology, things like that. Typically in your science textbooks, they will talk about development. They'll talk about, if they say 2 weeks, they'll mean 2 weeks since conception. All right. But if you are an actual pregnant person out in the real world and you go to, say, a doctor, and they tell you, hey, you are 7 weeks pregnant, that does not mean 7 weeks since conception for most people. I'll explain why. So what's different there? All right, so doctors. When doctors date a pregnancy, they don't start it from conception for a good reason. When I talked about it on TikTok, some people thought that perhaps they were just trying to confuse us or something, and that's not the reason for it. The reason is most people don't know exactly when they conceive. Some people do, but many people, it's just kind of like, well, I found out I'm pregnant. I have a positive pregnancy test. I don't know when I conceived. It could have been a multiple times. And so what doctors typically do is they start the pregnancy on the first day of someone's last menstrual period. First day. Now, not everybody knows that, but more people know that date than they know their conception date. All right, so they'll say, when was the first day of your last menstrual period? Now, some people have issues with this. Some people with polycystic ovary syndrome and other conditions on certain types of birth control, they may not have had a period in a really long time. But, for most people, they can at least estimate, at least give a pretty good close estimate for the first day of their last menstrual period. And they just take that day and they add 40 weeks. 40 weeks, and that's how they calculate your due date. The due date is not like this magical precise number. It's an estimate. It's the best we've come up with so far. And so, sometimes people will say, well, I thought a pregnancy was supposed to last 9 months. Well, I mean, that's a decent estimate, but 40 weeks is more accurate, and keeping in mind 40 weeks since the last menstrual period. Now, I often have students or people on TikTok and things like that, they'll say, but wait, what if you know that, what if you didn't have a last menstrual period to go by? Well, they might come up with some kind of estimate. They might look at the pregnancy overall, like looking at ultrasounds, looking at test results, and looking at growth, and they'll say, okay, we're estimating you're right about here, so we'll make up a last menstrual period, because I know that even like some computer systems, I know where I gave birth for both of my children, they had to enter in a date into their computer system if they had a client, a patient who was pregnant, and so like they couldn't continue forward unless they put some kind of date in there, and then everything was estimated, calculated based on that date. So they might have to estimate or make up one in some special cases, but typically they're going to go by that last menstrual period date. Now, why? Why, how does that help us in any way whatsoever? Well, we go by averages when we look at someone's menstrual cycle. Now, people use the word menstrual cycle different in everyday language. They may not necessarily use it the same way as like a developmental scientist would use it. But when I say menstrual cycle, a menstrual cycle goes from the first day of one menstrual period to the first day of the next menstrual period if a pregnancy does not occur. And then sometimes people will be like, well, wait, what about the last day of the menstrual period? What does that tell us? It really doesn't tell us anything, because people vary in their rate of flushing out stuff. And so the last day doesn't really tell you anything. Some people, their menstrual period will last 2 days. Some people it's 7 days. Some people longer. So, I mean, I think the average is like 3 to 4 days. But, so that doesn't tell us anything. We go by the first day. The first day to first day, that's your menstrual cycle. Various things happen during that cycle. A big one related to pregnancy is ovulation. Ovulation, when you release an ovum, what many people just call an egg. All right, so when does ovulation happen? It depends. It's complicated. But if we had to go by statistical averages and go by, well, what would be our best estimate, our best guess for when ovulation would happen? Your average, your mean, your textbook menstrual cycle lasts 28 days. Many people don't have 28-day cycles, and many people who have 28-day cycles can have an individual cycle that's not 28 days long. So it's not a guarantee in any way that someone's going to have a 28-day cycle. That's your average. That's your best guess, your best estimate. And within that 28-day cycle, ovulation on average is likely to happen around day 14 of the cycle. All right. There's going to be variability though, and that's where people get complicated issues with calculating due date and things like that. I personally, I know you didn't ask, but I personally, I had to go through fertility treatment, and so I had to learn a lot about my cycles. And one thing I learned is that I never ovulated on day 14. It's just not something my body ever did. Even if I had a 28-day or 29-day cycle, I would ovulate later than that. So pointing out that this is not a perfect system. It's the system that we have. It's the system that we're using. So based on that, you're essentially adding for most people, you're adding 2 extra weeks to the pregnancy. Why do we do that? Because it's it's the system that we've come up with. It has worked well enough for us so far. Now, when I say adding 2 weeks, the confusing thing, and this has confused many people, if a textbook person, a person with a perfect 28-day cycle who ovulates typically on day 14, and fertilization or conception happens right at the time of ovulation, I'll say a little in a bit, but that's not always a guarantee either. But let's say ovulation is the approximate time of conception. When someone gets pregnant, on paper, they are already 2 weeks pregnant. What? And I've had many students, but I don't understand what you just said. Okay, the way they date a pregnancy, the first day of the pregnancy is not the day someone becomes pregnant. It's approximately 2 weeks before, if they've got a regular cycle, 2 weeks before that time of conception. It's like you're not really pregnant yet, you're pregnant on paper, just for dating and timing and things like that. Is it confusing? Yes, it is, but that's how it typically works. So like when you go to a doctor, they say, if they tell someone, hey, you're 5 weeks pregnant, it's been about 3 weeks since conception. Now, some people ovulate later. It might be like 1-2 weeks since conception. If it's 1 week since conception, you probably wouldn't be able to get a positive pregnancy test yet. But it might only be 2 weeks since conception for someone who ovulates later. But it's less than 5 weeks. Less than 5 weeks since conception if you go to the doctor. Now, one thing I'm going to mention when I talk about this stuff, when I've talked about these things online previously, some people want to bring politics into it, and I can understand why. That's not my purpose here. This is just for education. So if you try to start that discussion in the comments, I will not reply. I am a professor at a public university. I've got to stick to the science. I can't get into the politics. All right. Not that you can't, but I'm not going to be able to get in that discussion in the comments. All right. So another thing that I'm going to mention, I mentioned fertilization. Fertilization might not happen exactly at the time of ovulation. Well, what's up with that? All right. So if you know anything about pregnancy, I'm going to kind of assume that you know that pregnancy begins when a sperm, a male gamete, to use some more fancy terminology, sperm fertilizes an ovum, a female gamete. You get this new individual creation called a zygote. All right, it's a single-celled individual with the chromosomes from both that sperm and that ovum. All right, so sperm and egg, I'll say egg because people typically say egg, even though technically the term is ovum. And by the way, if you have more than one, which can happen, it's ova. Ova is plural of ovum. All right, so when those two meet, do they have to meet like basically the relations? Sexual, if the pregnancy results from sexual relations, which it doesn't always, it can result from insemination, you can have IVF and things like that, but if the pregnancy results from sexual relations, do those sexual relations have to happen on the day of ovulation? They do not. All right. One issue is the ovum. Once ovulation has happened, once that ovum is released, it can last up to about 24 hours. All right. So it might be the next day when the pregnancy actually begins. And then the sperm, oh man, the sperm really mess up the timing. When I first started teaching, I had textbooks that said that sperm could last up to 3 to 4 days once released. Now, the textbooks that I'm using, they now have updated it to say as much as 6 days. I think 3 to 4 days is like more likely, but they have evidence of as long as 6 days. So you might have had sexual relations days before ovulation and the sperm are hanging around. That ovum gets released and the sperm are like, hey, you joined the party, let's fertilize. And so that's another reason that timing is not exactly precise. All right, there are more things that I could cover, but that's going to be my first video about just basic stuff that students get confused about or ask about regarding pregnancy.